Hey everybody, this is Jim Prusak, physical therapist at the Pain PT, and today we're going to talk about the hip and in relation to chronic pain. And we want to look at the hip imaging findings because the question I'm going to raise here is, are all hip imaging findings pathological and related to pain? And we know with chronic pain that we need to move a lot of times beyond the structural changes to the brain and nervous system for our answer. So I'm going to show you here today that there's a lot of data coming out showing that, in fact, just like with the spine and other joints of the body, we see changes. We see changes happening as we age. Yet many of these changes are normal and part of the aging process versus being pathological. Let's get to some of the data. So this first study was done on professional collegiate hockey players. All these hockey players aged 18 to 35 had zero pain, but what they found when they did MRIs, they found that over half of them had labral tears in their hips. Over 30% of them had muscle strain injuries, and 5% of them had tendinosis of the hips. Overall, the study found that 70% of the players had irregular findings on their MRIs, but no clinical symptoms. So this is pretty significant when you see 70% of high-level hockey players having MRI abnormal changes and findings, yet they don't have any clinical symptoms. So the authors say this. They basically say that the study raised many questions, but the value to surgeons is to recognize that imaging doesn't replace good clinical judgment. The study might make you hesitate to read too much into an MRI. And this is what I'm trying to show you here, is that we cannot just diagnose a patient off of their MRI, X-ray, or CT scan. So this study, 2005, looked at people with osteoarthritis, and it took over 1,000 people over the age of 45, and they did X-rays on these people's hips. What they found was an association of pain with severe osteoarthritis, but no association of pain with mild to moderate osteoarthritis. So that kind of makes sense. If you're having severe osteoarthritic changes on an X-ray, that is associated with pain a lot of the time. But anything less than that, there is not a clear association with pain. In fact, in that 45 to 54 age group, only 22% of the participants who had severe OA had pain. So that leaves another 78% of people that don't have pain with severe changes. As people get older, the percentage of pain does increase in the range of 54 to 70%. What the authors found and what they concluded was this: mild to moderate X-ray change is very frequent and not related to pain, whereas severe change is rare but strongly related. And this makes sense. We need again to look beyond just the X-ray findings to determine our diagnosis. In this study, 2012, they looked at the prevalence of what I call, quotations there, abnormal hip findings in asymptomatic participants. So again, these participants had zero pain, and what they found after doing MRIs is they found that 69% of these people had labral tears in their hips. They found chondral defects in 24%, and they found a whole bunch of other changes, as you can see here, in these participants. All of them had no pain, yet they found these, what they call abnormal findings, show up. So their conclusion was that MRIs of asymptomatic participants revealed abnormalities in 73% of hips, with labral tears being identified in 69% of the joints. So my question is, how can we call these findings abnormal when they're showing up in a large percentage of people who have no symptoms and have no pain? Could it be that these findings are just age-related changes that we see, or wear and tear changes that we see, and they don't necessarily correlate directly with pain? Another more recent study, 2017, looked at 63 asymptomatic people and then 63 people who did have symptoms. And what they found was, in the people who did not have any symptoms, 57% of them still had defects in their cartilage and labrum, whereas 80% of the symptomatic people had the same defects. So there wasn't a clear difference there, even though it's a 20% difference, more or less. The fact that almost 60% of the people who had zero pain had similar changes. They concluded this: a substantial number of asymptomatic volunteers had labral tears, defects of the cartilage, and our data demonstrate that not all cartilage and labral defects of the hip are symptomatic. And this is what we've been finding in the other studies. And this leads to the last piece here, which was an editorial commentary written in the journal Arthroscopic and Related Surgery. And the authors basically are questioning what we call pathological findings that we're finding in asymptomatic individuals. And like I mentioned earlier, they're starting to question whether these findings are actually abnormal and pathological at all. And here's a quotation: "If the patient is asymptomatic, perhaps reported findings should not be labeled pathologic. Hip imaging researchers may need to reconsider what represents an abnormal radiologic sign." And I'll go on to say that doctors and other medical professionals also need to reconsider and look at these findings maybe in a different light. The authors also go on to say this, which is quite interesting, and we'll talk about it in a few of my other videos. They're challenging the knee and shoulder imaging findings as well. They say, "We realize that knee and shoulder imaging researchers may also need to reconsider what represents abnormal." Basically, we're finding the same thing, just like we found in the spine, the hip, the knee, the shoulder. A lot of these changes that we're seeing are age-related, natural changes that many people have, and they're not directly related to pain. And we need to be very careful when we tell a patient that a certain change is what's causing their pain, because that can actually make patients worse, and it may not be an accurate statement. I hope you enjoy this here today. If you have questions, you can reach out to me at the Pain PT. Thank you for listening. If you like the video, please give me a thumbs up, and have a great day.